Hello, welcome to our next informative series on pregnancy and chiropractic, and perhaps what chiropractic can do for someone that's pregnant. I want to gear this towards maybe the first time mother, or perhaps an existing patient that's got back pain, or maybe somebody that has no idea what chiropractic is and what I can do for it. So one of the reasons we have Betsy here today is she's obviously pregnant. I'm going to tell her story pretty soon, but I think chiropractors can do a lot for the muscles and joints in the body. The American Pregnancy Association states that 50 to 75% of women will have back pain, whether it be their upper neck, mid back, or lower back. And that's due to a multitude of reasons. Your center of gravity with your spine. Obviously, as we put on more weight with the baby, typically our spine should look like that. What happens is there's more of a increased pressure on the joints of the spine. There's also hormonal issues. There's more fluid that's retained. Plus there's the whole center of gravity. And I think that's why a lot of pregnant women have pain in their hips and their low back or some of the other joints. So I thought I'd have Betsy explain a little bit what I've done with her over the last few months. Also where she's at in her pregnancy, and hopefully I'll have a baby pretty soon. So Betsy.
I am almost 38 weeks along, actually tomorrow, and Dr. Byers has been adjusting me pretty much the whole
way through
since I found out, and it has been a tremendous help. I started out with low back pain, and then it kind of went up into my mid back, and then I had some pain in my ribs and at the top of my stomach, and between adjustments and then the kinesio tape, I was able to get a lot of relief, and it lasted probably, I've seen once a week maybe, just for some extra relief. But and I've gained almost 40 pounds, so I obviously don't have the pain usually that I'm having now. So with the pregnancy, it's been the best relief that I've gotten.
So I thought what I'd show you next is what actually happens during the adjustment. One of the things, as Betsy says, typically we don't work with anybody that's 4 weeks or less in the pregnancy. I think as a new mother, obviously we want to make sure that the fetus attaches and it does its thing in the womb. We don't want to mess with Mother Nature at all. But once the cell starts to divide and the baby becomes firmly implanted, weeks 4 through delivery actually is the best time for that. I know I have 2 boys, 12 and 8, and I adjusted my wife probably once a week up until they were both born, and she said it significantly helped her hips especially. So anyways, I thought I'd show you what I do with pregnancy, and hopefully we have a good experience. I'll show you first what I do for the neck adjustment, and then I'll show you on the pelvis how that looks like. So, okay, Betsy, you can lay in your bag. I've already done a pre-assessment on Betsy, so I kind of know what I'm doing with her. I would never go on just cold doing things, but basically what I like to do is I find out which joints aren't moving, are stuck, fixated, restricted, however you want to call it, and we get moving on those joints again. A lot of patients will ask me about hearing noise. I'm going on your side. To me, all it is it's a tight joint and there's some movement. It's a bonus if you hear noise. You don't always need to hear noise. So, my 8-year-old likes to call it popcorn. Wherever the case works with it. As you can see, this is very safe what I'm doing on her. Other side. Basically, the joints that are stuck, all I'm doing is providing a lot of relief. Once again, she is 37, 38?
I'll be 38.
Yeah. Good. That's it. Thank you very much. If you have any further questions about pregnancy and chiropractic, you're welcome to go to my website, www.drjimbyers.com, and hopefully answer your questions. Thank you very much.